Welcome to today's webinar, where we're going to talk about growing your practice through a personalized patient experience. This is a very important topic since healthcare is a service, right? Part of the service is a procedure and the surgery, but yet the rest of it is all about communication and service. And if you ask patients about this, then they say, 96% of all patient complaints have nothing to do with the actual care. They're actually all about the service they receive and the communicational aspect. So today we're going to talk about that. So I'm super excited again to have Chirag, Brittany, and me on this webinar. And maybe before we start, why don't we introduce ourselves, and maybe we start with Brittany. Maybe you can give us a little bit of introduction about your background and etc.
I'm Brittany Danbury. I'm a PA, physician assistant. I have been a PA for 8 years, mainly in dermatology. I have worked in both Florida and New York.
Wonderful. Great. Chirag, do you want to take it next?
Yeah. No, Simon, thank you so much. And listen, we're super excited to be co-hosting this with you. Obviously, we share similar investors, same investor, actually, one of them. And I remember when Marg and I were pitching Lara Hippo and they had mentioned this company called Clara. And so it's great to kind of see it in some ways come full circle and working closer. So thank you so much. And Brittany, again, thanks for being here as well, and excited to dive in deeper. Hi, everyone. My name is Chirag. I'm one of the co-founders and the chief marketing officer here at Medley. Really what Medley is we're a digital pharmacy. And coming and being second generation pharmacy owners, we saw a lot of the issues that patients, doctors, manufacturers, and all of these stakeholders have with the pharmacy. And our vision was, how can we build the pharmacy from the ground up by leveraging things like distribution, a stronger customer experience, and technology, and combined bettering kind of the patient experience as a result. So, we started the company in June of 2017 and have scaled the business significantly since then to multiple markets. So excited to dive in deeper and chat more about that.
Wonderful. Yeah, welcome. I'm equally excited, especially also having, Brittany on the in the webinar, and also speaking with Chirag, because there's a lot of customers that are using both Clara and Medley Pharmacy, so that's exciting to see. And one of the things that we're going to talk about is how using both Clara and Medley obviously influences improving a patient experience. A little bit more about me. I'm, like I said, I'm Simon. I'm one of the founders and co-CEO of Clara. We are an end-to-end patient communication platform. So our goal is ultimately to reduce the pain of the phone, to be honest, right? We all, if we work in practices or if we're patients, we all know the problem of phone tag, and Clara is solving exactly that problem. And we do this by moving the conversation away from the phone onto messaging. And so we are converting phone calls into messages. We're digitizing the entire patient experience. So call it patient intake, scheduling, everything before and after the visit. And also a lot of things that we do are related to automation. So anything that happens before the visit and during the visit can be automated by Clara. So again, we're an end-to-end patient communication platform offering seamless video visits, smart messaging, and efficient team collaboration in all in one platform. Today, we serve thousands of healthcare professionals across more than 40 specialties, many of which are independent medical practices. So, yeah, in this webinar today, Chirag and I will chat with Brittany about the impacts about both Clara and Medley, and how much what impacts that had on her practice or daily work, basically. And most importantly, we'll focus on, her patient experience and how this has elevated using our both services and other takeaways. So please feel free to put any questions that are also not related to us. We don't want this to be too commercial, obviously, and we want to really make this an interesting exchange of information. So why don't we start with you, Brittany? I'd love to just get a general idea of, can you just paint a picture of the size and scale of practices that you work with in the past, like specialty size, most typical patient cases, etc.
Absolutely. So I have worked for 2 practices, both in dermatology. One was a very small practice. It was just me and one other MD, and that's it. So it was a very small boutique practice. And then I've worked for an incredibly large practice with multiple providers, both PAs, NPs, and MDs, and spread throughout multiple states. So I've worked in both ends, but all in dermatology.
Sounds super interesting. What do you love most about your job?
I love helping people. That was the main reason I went into medicine. Being in dermatology, I love diagnosing, treating. I love that I can do surgery, I can do cosmetics, and it's always interesting to me. Got it.
And like nowadays, everybody's talking about COVID and the pandemic, and and obviously can you just share a little bit what you went through in the beginning of the year, where nobody knew anything, and then suddenly this craziness came upon us, and now we're again in a different stage because everybody adjusted to it. Can you just share a little bit how you experienced COVID in your work?
Absolutely. When COVID hit, I was working in New York, so one of the biggest pandemic epicenters, which made it even more interesting. Working in Manhattan and in New York, we ended up shutting completely down for 6 weeks. So the month of April and part of May, but we still wanted to be there for our patients, and we still wanted to give access to our patients in terms of patients that are suffering from rashes and issues and patients that needed refills. So I was very fortunate to work with a practice that immediately started telemed within about 2 or 3 days after we shut down. And our telemed was done directly through Klara, which was great because Klara was something we were already comfortable with and we had been using for about a year. So it was not a new system to us. And it was not a new system to our patients, which was also great. They had already been messaging us through these systems. We had already been contacting pharmacies with this system. And so it was actually a pretty easy transition, which was great. And I felt like we had no gap in patient care, which is huge. And I can tell you there's a lot of practices throughout the country that did not have as great of experience as I was able to have with my patients.
That's great to know. Sorry, I was on mute. That's great to know. And super excited that we were able to help you guys. Talking a little bit, you mentioned Klara already, obviously, and you also said that you were using Klara for a year already, right? And then came the pandemic, and then you used also the video call visits. So you never used video calls before the pandemic. Why was your practice looking for a solution like Klara in the first place? What were your biggest inefficiencies and struggles?
So the biggest inefficiency at the practice I was at, which is still a pretty large inefficiency, is our call center. And this is the area where calls are coming in, and there's over 50 to 60 practices within the group that I was in. So think about the amount of calls coming in and how long it took me to actually get those messages. And that was a big problem within our practice. Patients were complaining that they didn't hear back from us for days, messages were lost. If a provider was out or an MA was out, messages weren't received. And so Klara was kind of able to, what my practice did is they made a task box. So I had a Brittany Danbury task, and that is where it always went. And then I had my own inbox. And the nice thing about the task box was that anyone in my office could grab that. It could be a medical assistant, it could be front desk, it could be a manager. So someone was able to check it at all times. And it was just able to cut back as well on the amount of calls coming in, because when you have so many calls coming in, people are on hold and they get frustrated and they give up. And you aren't booking as many appointments because you're dealing with refill requests and pharmacy calls. So Clara was able to kind of filter some of those things and make it easier for our practice to handle the amount of volume of calls that we were coming in. I think you're on mute again, Simon.
Oops. So the biggest difference that you saw before and after Clara was in regards to patient experience, call volume, etc. Maybe can you share examples, like concrete examples, where you really felt the biggest impacts there?
I would say the biggest impact was when you're playing phone tag with a patient. And it kind of goes back and forth and they still have more questions. So you finally get a hold of them, you think you answer everything, and then they call back 5 minutes later for more questions and I don't get that call. Because when I'm in the room with patients, I'm not next to the phone, and I tell my medical assistants, don't take me out of a room unless it's an emergency, unless it's another doctor calling. I try to really stay in the room to stay engaged with my patients. So the nice thing about Clara that I love the messaging system is I can send a message, hit send, and when they reply back, I will reply back as soon as I can, and they can continue to ask these questions. I also love in Clara how they can send photos if there's, they're having a reaction, anything like that. I also do a good amount of cosmetics, so it was great for me to connect with patients cosmetic wise and let them know, like, hey, I got this bruise, and I can tell them that bruise is normal, versus on the phone when someone tells you they have a bruise, you have no idea what you're looking at. And so that was a great way for me to engage with my patients. And I also loved how my medical assistants could also help me with some of these tasks. Working for a very busy practice, I had a lot of messages and a lot of tasks that I couldn't handle all on my own. And my MAs were able to kind of filter what questions I should be answering and what they can help with.
Cool. Because I also would like to speak a little bit about Medley, but before we do that, one last question: how do you think it has affected you in your daily day? Like, would you say you would have, saved X amount of hours, or like, just tell me the impact on you personally?
The biggest thing that I noticed is I felt like I was able to get out of the office on time every day, which usually never happened. And B, when I left the office, I felt like I left with everything taken care of. I never like to leave the office with a phone call up in the air or something that wasn't done. And with Clara, I was able to check my inbox. I know all my patients' questions are answered, and I can go home knowing that that's all taken care of.
Amazing. Switching to Medley a little bit, and Chirag, feel free to jump in. How did you hear about Medley? How did you hear about them? Why did you sign up? And what was your experience with them so far?
So I had heard about Medley. As we all know, dermatology products and prescriptions tend to be on the most expensive end. And so we all have issues getting the products that we want our patients to have. And I had heard about Medley the first time when one of their representatives came into the office and introduced himself to me and kind of told me the services they were able to provide and things like that. Before working in New York, I worked in Florida for, like I said, a very, very small practice. At this practice, any PA that came in, I took care of myself, and I could be stuck on the phone for hours, and I would be there in the office way past my, normal times dealing with PAs. So moving to New York and hearing that there was pharmacies that could help with this was huge for me, because I would rather focus my energy on taking care of patients, what I love to do, and answering questions that I need to answer versus having to deal with insurances and prior authorizations and, ultimately getting medications that I want my patients to get.
No, Brittany, that makes total sense. One thing just jumping off of there is, could you maybe speak a little bit about how or why the pharmacy is important to your practice? Like, how does it become an extension? And of course, follow up there with, just from your experience with Medley is, you spoke about the PA, you spoke about insurance and kind of handling some of that, but were there other critical aspects that made recommending Medley to your patients more of an important option for them?
One of the other huge things with recommending Medley to me was that you guys are on Clara and you were able to contact me directly. So I was able to form a relationship with you and your pharmacist directly and know who I'm talking to. That way you guys can get to know my preferences and you can directly get a hold of me if something comes up, if a medication is too expensive, if it's not covered, if a patient wants an alternative, versus if it goes to a local pharmacy, I don't hear from them for days. And then the patient is frustrated that they haven't gotten their medication and they've waited. So I love the fact that if I send a script to you guys and there's any problems, I'll hear from you within hours and I can resolve that issue. You know, one of the more frustrating things as a provider is you get a patient with an appointment, you have them in the office and you drive well and it's a great experience for them. And then all of a sudden they leave the practice and they have a terrible experience with the pharmacy. And that directly reflects on me as a provider. And so it was really important for me to grow a relationship with a pharmacy that we could know each other very well and contact each other directly. You know, I've always said with Medley, and you know, you guys have my cell phone number, you have my email address, you have my Clara, and there's always a direct line that's open, and you can't do that with other pharmacies.
So interesting, and Chirag, just chiming in there, you speak a lot about like Klara and Medley. Could you also like speak about like how they're basically interwoven with each other, and then maybe also talk about patient experience, like how these two things made such a big impact on improving the patient experience?
Absolutely. I mean, so the nice thing about Clara is it's not just connecting patients with providers. It's connecting patients with providers, providers with pharmacies, and then back pharmacies with patients. So it's a great big triangle, which is huge, because if I have a patient message me on Clara and they say, hey, my prescription was really expensive, what can we do? I can immediately start a new conversation with the patient and with Medley. And then I can say, hey, Medley, the patient has questions about their prescription. Can we figure out a resolution? And the three of us can all be on a chat together to figure out a resolution together, versus me going to a local pharmacy and I have to call the local pharmacy. I have to get alternatives over the phone, and then I have to call the patient back and provide them the alternatives, and they can pick what they want, and then I have to call the pharmacy back and say what the patient wants. I mean, you end up on the phone all day for one prescription, versus an easy chat where everyone's on the same page. And I just think it's really nice. And then going forward, whenever the patient has additional pharmacy questions, they know that they can go directly to Medley. And almost, it doesn't remove me from the equation, but it helps that I'm still there if you need me, but you know how to directly get a hold of your pharmacy.
So interesting. And I always ask myself, like, you know, how are patients now coming to you? Do they say like, this has helped me tremendously? How are patients reacting to this new way of, you know, how healthcare is being delivered in the combination of Medley, which is doing fantastic things, and Clara?
You know, I will say when we first started using specialty pharmacies and Clara, patients were a little more hesitant. I think it was new to them and they weren't quite sure if they were going to want to be a part of the whole technology boom. But then, you know, one of the few things that came good out of COVID is that people have now realized that how easy this makes life and how important it is. And it's really helped patients transition into using Clara and Medley, and they don't have any doubts. And after they start using it, they find out how easy it is and how much it helps their life and how much, you know, those kinds of things.
Cool. We got a question here, and maybe Chirag or Brittany, you can both answer this. What all does Medley offer? Is this a specialty pharmacy?
Yeah, happy to take that. And then of course, Brittany, you know, you spoke a little bit about your experience with Medley and Clara, so feel free to add on. But, you know, we're a digital pharmacy. So we have one brick and mortar pharmacy in a major metropolitan area. And some of the services that we offer, some that Brittany, of course, has mentioned, specifically for the provider, is prior authorization, right? So assisting with the prior authorization process, giving updates on the delivery status, of course, but also consumer-focused services, such as same-day free delivery, for example, a mobile app that customers can use to manage their medications, having transparency around what the cost of medications are. And to the other question here around, is it a specialty pharmacy? We are, and we have taken a very specialty-driven approach to help patients through their therapy, right? So, you know, whether it's having pharmacists on hand, as Brittany had mentioned, to assist with any questions that patients might have. These are some of the aspects that we believe are important in order to deliver better outcomes. And I think, Brittany, you spoke really briefly about why was it so important to use a tool like Clara to connect the pharmacy, the doctor, and the patient. And I think one of the things that we've done a great job of through the use of Clara as well is being able to deliver some of those more specific nuances that would traditionally get left in the pharmacy alone through services like Clara, but also traditionally through a pharmacy like Medley. Great. And Simon, if it's cool, I'll just go ahead and answer.
Yeah, please.
So where is the actual pharmacy? Do you have pharmacy? So just to clarify, we are the pharmacy. So we don't work with other pharmacies. And I think, you know, I don't want to speak for you, Brittany, but I think that's another huge value prop because you're getting consistency of service on an ongoing basis. So our pharmacy in New York is in Brooklyn. Our pharmacy in New Jersey, you know, is near Jersey City. In Philly, we have locations, so on and on, right? So, excuse me, not Jersey City, Somerville. So we have the actual brick and mortar, and we use that as a basically a centralized location to deliver the medications.
Fantastic. I love that there are so many questions coming in, and please, to all the attendees of this webinar, feel free to just message in. We'll take these questions and try to answer them ad hoc. Going forward a little bit, Brittany, is how do you think patients? How do you think the future of the future patient experience will look like, right? Because everything is changing. COVID has made a push to all these technological or online products like Medley or Clara. How do you see the future? And then we'll take another question that just came in.
So I think, one thing that hasn't been touched base on yet is the delivery of Medley. And it's one of those things, we're all working from home. We're all home most of the time, and we're trying to limit our amount of activities out of the home. And I think that's where the delivery service is huge, because that can prevent you or, stop you from having to go to a pharmacy and stand in line at a pharmacy and get everything delivered directly to your home. And so that's one point that I wanted to make about Medley as well. And I think that's really important for us to continue to keep ourselves healthy, as well as our neighbors and our other, patients and family and things like that.
Got it. And how do you think about like patient communication, like looking at Clara was like an end-to-end communication? How do you think this is going to happen in the future? How will the patient schedule their appointment and then fill out their paperwork, and how will the follow-up be happening? How do you think this is going to be?
So as we transitioned into telemed, we started utilizing Clara even more for these kinds of things. So now we've gotten to a point where we will collect insurance cards on Clara before the visit. We will send, patient data information in terms of past medical history, allergies, all of that can be filled out before the visit. We also are able to collect copays now and send them a link directly in Clara on how to pay their copays. And all of these things, all of these little tiny steps, which seem little, but in the end they add up, allows me to spend more one-on-one time with the patient. So when I'm on telemed call with them, I don't have to wait for their insurance information. I don't have to wait for them to pay their copay. I can just start the visit and I have a full amount of time with them. And I think that is going to keep being an instrumental piece going forward, especially as patients want to continue to have visits at home. As important as it is to have Medley deliver prescriptions to home, it's just as important for patients to take their visits at home. Yeah,
and just a follow-up question, because you also use Clara for patients that are not just televisits or video visits, right? You also use Clara to collect insurance cards and remind them of their appointment, and etc. All the things that you mentioned, if there's not a telemedicine visit, is that correct?
Absolutely. So, we used Clara long before telemed. And, before that, it was a messaging system. And so, when I first started at this bigger practice and I found out, I got more and more complaints and issues with customer service about, I left you a message and I never heard from you. It took you, it took your office 3 days to get your message to you. And so what I started doing in the very beginning is I started giving out my card with my email address, which was a great way for me to keep connected with patients, but it was also difficult for me to manage that all by myself with the amount of patients that I was seeing. So Clara was kind of this, gift that I was given of a way that I didn't have to give out my personal information in order to keep patient customer service high. And it was a great way for me to connect with my patients and let my MAs connect with my patients and my managers connect with my patients. And so that's a huge thing. Another thing too is we've now made another task box or 2 other task boxes, one for our billing department. So if I have a patient that says, hey, Brittany, I have a question about a bill that I received from you, I immediately can assign it to my billing department in Clara, and they can take care of it from there. And I can say, hey, patient X, I've connected with my billing department. I've assigned this a task to them, and they'll get back to you within 24 hours. Same thing with scheduling. I got to a point where patients were emailing me about appointments. Can I have an appointment for next Tuesday? And it's hard for me to manage scheduling appointments as well as seeing patients. So now I can assign that task to my scheduling department and say, patient needs an appointment, and they can take care of it from there. So it's nice that we have all of these channels and these boxes that we can kind of assign to the correct person so it can be taken care of faster.
Great. Chirag, there's another question, I think, for you. It says, is there a pharmacy in the DMV area?
Yeah, just to answer that. So we have a pharmacy in Baltimore. And one of the things we were talking about offline is that we've recently been scaling the pharmacy. So getting a pharmacy in each major metropolitan. So the vision for us is to be in all the major metropolitan areas in the next 18 months. So that's something that the team is working very hard on doing. So I think I see some additional locations. So the goal and the plan here is to have one Medley in each of these major metropolitan areas that we can use to deliver prescriptions to patients' homes.
Great. There's another question. Do patients not use your EMR portal for messages and appointment requests then, and only use Clara? ? So
it kind of depends on the patient. And I'm okay with whatever they're comfortable with. I do have some patients still email me, and I do have some patients send me messages in our EMR portal. But like I touched base on, the portal in EMR does not allow me to connect with the pharmacy as well. And so that's one huge thing, that Clara has that ability to connect directly with Medley. And as patients realize that, then they tend to use Clara more often.
Yeah. And would you say, you had a portal before you used Clara, right? Do you think there's more patients using Clara than the portal? And why would you say this is the case?
So actually, we didn't have a portal before. We were on Nextech, which did not have a portal, which is kind of crazy, which is why there were so many issues with our call center and so many issues with the emails that I was receiving. And so we introduced Clara first. And so that was kind of our patient portal. And that was the only portal we had. And then about 6 months into using Clara, we transitioned into Emma, which did have a patient portal. So I would say most of my patients are more comfortable and more used to Clara just because we introduced it first before the portal was even an option. And that's where Clara was even more important, because I didn't have that portal to be able to send things to patients.
Got it. One thing there to say is our adoption rate is 85%, from the patient side. Do you think patients would adopt the portal also to such an extent, that you have an adoption rate from almost, every patient on the portal side?
It's hard to say. And I think that one hard thing about patient portals that even I've realized is that my internal med, my OBGYN, my dermatology, they all use different portals, which I think can be a little tricky. Where Clara, it can be any specialty. And it kind of groups all these specialties into one portal in my mind. And so I find it to be easier to utilize that one instead of having a different one for each office that I go to.
Got it. There's a question, does Clara screen phone calls or just offer a messaging system and video chats? Brittany, why don't you take it and then I supplement it?
So what I've noticed is recently it started to take phone calls, and it will type out the message, and then I can also listen to the patient's voice. And then that way it can be assigned to me. And the other nice thing that I haven't mentioned yet with Clara and with Emma is I now can directly connect Clara and Emma. So if I have a patient that I'm opening up and I'm looking at their Clara, I can click and it'll open up an Emma, and I can look at their entire chart versus me having to actually search it, vice versa, which I think is huge.
Yeah, and maybe just to add onto this, so we connect into the phone lines. So we first of all transcribe voicemails. This is exactly what you said, Brittany. What it happens when a patient leaves a voicemail, then this voicemail is transcribed into Clara, and the patient gets a text notification saying, "Hey, sorry that we missed your call. For a faster response, text us here." The other thing is that we also put a web messenger on every practice website, where patient can just when they're on the website just start chatting with you, which is a much more effective way than form fills. So you have a much higher conversion there from eyes on the website into feed into the practice. And also you're triaging these these questions from the patients into a messaging flow, which is easier to handle. And then also we give every practice a textable number, so that patients, you can put it on your business cards, or you can put it on your social media, or hang it put a poster in the office. And then before they come into the practice for a visit, they can also text the practice. Last thing is we also have the phone greeting, which is basically, and that's also something we introduced in your practice, is basically telling, you can include Clara in your phone tree and basically say, if you don't want to wait on hold and prefer texting with us, please press 1. And then patients can say, yeah, I don't want to wait on hold like we do for so many other services. Press 1, it hangs up the phone, sends the patient a text message, and asks them what they want to do for. And then again, we cover the entire patient journey. So we do online scheduling, reminders. Then we you talked about insurance card collection, filling out forms, and then powering the video visit, and then also the entire aftermath of the patient follow-up. So I'm just going to take one more question, and then I think we will conclude this webinar. I think this is the right way to do it. How long does it take to get Clara set up in the office? So it depends on the size of the practice. So it's 5. We can do it within a couple of days, or depending on how large your practice is, and this can then take a little bit more. But it's very easy to set up. Maybe Brittany, is that hard to learn for the staff to use something like Clara? I mean, at the end of it, it's text messaging.
I find it to be incredibly user-friendly. You can log in on your desktop, you can log in. I have the app on my phone, and so I can log in that way. And I mean, with the large practice that I'm in, we have all age groups of providers as well as medical assistants. And I found that everyone was able to adapt.
Perfect. If there is no other question, I think we are about time. Brittany, thank you so much for taking the time to do this. I know we are all super busy, and so I really appreciate that you took the time. Also, Chirag, it was amazing to do this together with you. We co-hosted this together. We did it for the first time, and I think it went flawlessly. So yeah, thank you for taking your time, and I wish you all a perfect rest of the day. Wonderful.
Great, thank you so much. As you can tell, I'm very passionate about both Medley and Clara, and it's changed my practice significantly over the last year. And I just hope that other people are able to utilize both of these services as much as I have been able to.
Wonderful. Thank you so much. Have a good rest of your day, Brittany. Thank you so much, Chirag. I see you soon. And yeah, take care. Bye-bye.
Thanks, guys. Bye.
Thank you. Bye-bye.